in a very short span of time as a young, talented and bright consultant. She is nobody other than Dr. Shahzadi. I would request Dr. Nadina to please the lecture.
Thank you so much, Dr. Mayor, and for this kind introduction. Bismillahirrahmanirrahim. Assalamu alaikum everyone and good afternoon. Today I am going to present a very different topic regarding the case from the gastroenterological department of Children's Hospital, Faisalabad. The case is a 2-year-old child who was presented with complaints of loose motions, vomiting and respiratory distress since the age of 6 months off and on. This is our hospital, Children's Hospital, Shahzadi. This is since the age of 6 months off and on. This is our hospital, Children's Hospital. This is the video, if anyone can comment on it. No, like a liver stenosis there. And you can see bicam is 14. तो ये किसको फेवर कर रहा है? Metabolic acidosis को स्टोर different chest infections. Thank you. And can be the case of cow's milk protein allergy. Yes, it can be the case of CMPA patient. Could they have acidotic breathing? What would be the cause of acidotic breathing? Weight was 12 kg, which is between 25 to 50% diet. So final diagnosis is fructose 1,6 bisphosphate deficiency. Now coming towards literature review. Madam, I coming towards the demographic details of the patient. My patient name is Ahmed. He was 2 years old and he was resident of Jadamala. He was presented with fever, loose stools and vomiting for last time.
Having invincibility in her field, and I can say in the words of the poet, दिल में दर्द आंखों में नमी बन जाइए, दिल में दर्द आंखों में नमी बन जाइए, इस तरह मिलिए कि जुज़्वे जिंदगी बन जाइए, जिस तरह खाली अंगूठी को चाहिए नगीना, जिस तरह खाली अंगूठी को चाहिए नगीना, आलमे इम्कान में ऐसी कमी बन जाए।